What brings you in today?
I went to my doctor and I was diagnosed with having breast cancer, and he said that I will need a bilateral mastectomy and I should come to you to see what my options are for reconstruction.
Okay. So when I think about reconstruction, there are things that we want to think about, you in particular, your medical history, but also in general, what are the options? What are the ways we reconstruct a breast? So I'm going to start with not you in particular, but in general, the ways we reconstruct a breast and the tools we have to do that. And then we'll get into your specifics after that. So when I think about breast reconstruction, I think about it in three big categories, three general ways that we reconstruct a breast. In the first big category of breast reconstruction, we use implants to reconstruct your breast. So when all is said and done, at the end of the day, your breasts are made from implants. What happens at the mastectomy is that the breast tissue is removed from the skin, and most of the time the nipple and the color around the nipple are removed. And so you still have your skin, your own skin, left behind, and that's what we use to make you the new breast, and we put an implant into that skin, and that's how we reconstruct your breast. That has pros and cons, and we will talk about that afterwards. The second big category of breast reconstruction is where we use your own tissue to reconstruct a breast. The most common place that we take that tissue is the tummy. So we take the fat and the skin from the tummy, we leave the muscle behind, and we take it off the tummy and we put it up to where the breasts are, and we shape it to make it look like nice, beautiful breasts. So when all is said and done, at the end of the day, instead of having your breasts made of implants, like the first big category, your breasts are made from your own fat and skin. So if you're too thin to have your tummy and it's not an option, we can take fat from other areas of your body, such as your thighs or your buttock. So no matter what your body habit is, we usually can find, if you're very, very thin, we can't do it, but if we usually can find an area to take your own tissue from. So that's the second big category of breast reconstruction. The third big category of breast reconstruction is where we use a combination of the other two. So the implant and your own tissue to make a new breast. And the most common place that we take that from is the back. So we take the back muscle and the skin that's attached to it, and we bring that around, and we use that skin and the muscle there to make a new breast. But we need to give you an implant underneath that to make the breast full, to give the volume. Those are the three general ways and how we can reconstruct a breast. And then when we think about it, we have to take those categories and see what's best for you and how to apply that to you. And there's different ways that we think about which one would be best for you. One of the ways we think about which one would be best for you is your medical problems and your body. So what you have to offer, whether you have fat to offer in order to reconstruct your breast that way. A second general thing is what kind of treatments you'll need. Whether you need chemotherapy or radiation therapy will change the way we think about how we're going to reconstruct you, and we'll talk about that. And the third way we think about it is what you prefer. Some people would prefer implants, some people would not. So all those reasons come into play when we talk about how we can reconstruct your breast. Do you have any questions so far?